everyone, welcome back to this YouTube channel, and today we will discuss about what cataract is. So do you know what cataract is? I have realized in my 20 years of experience that most of the people, in fact I would say less than 20% of people know actually what cataract is, though this is such a commonly used term. Many of us call it Motiyabind or Motia. So what is this Motia? There are actually two kinds of Motia. One is Phacoemulsification, which is called cataract, in which the lens of your eye becomes whitish, and the second is Kala Motia or glaucoma, which is a separate disease altogether. So here today what we are talking about is Phacoemulsification or cataract. So what exactly is this cataract? All of us in our eyes have got a lens which focuses our image on the retina. This lens is normally transparent like glass, but with age it can become a little whitish, or you can say a little like a frosted glass. And when it becomes a little whitish, it does not allow a clear image to be formed in the retina, and this is a phenomena which is called cataract. It is an age-related phenomena. It is something which is similar to the graying of our hair. Just as we all will have gray hair with time, similarly we all will develop a cataract in which the lens of our eye becomes a little whitish in color. And as it becomes whitish, the image keeps getting more and more blurred. Since this will happen to everybody, it's a universal phenomena, but to some it will be a little earlier, and to some it will be a little later, and to some it will be significant, and to the others it may not be so significant, and whenever it becomes significant it needs treatment. So how will you know that you have a cataract in your eyes? One simple symptom is that there will be a blurring of vision. But before this blurring, there can be other symptoms which can warn you that you have a cataract in your eyes. These can be, you may have a doubling of vision. If you're seeing the moon, instead of one moon, you may see two moon or three moon. We call it diplopia or triplopia, and sometimes you may see four moon also. The second can be, there can be a scattering of light. So some people, they complain that whenever they see the headlights, they find them a little scattered. That's because your lens has become cataractous. Then the third can be, there can be colored halos, which means around lights you may find that there are some colored rings. Again, this is a symptom of cataract. So if it's a universal phenomena, then who are the ones who need a treatment for their cataract? Whenever the cataract is such that it is affecting your way in such a way that your daily routine activities are being hampered in some or the other way, then this means this is a stage where you need a cataract surgery. For one person, this may be even if that person has a less cataract. For another person, this may be a stage when the cataract is a little more advanced. So basically, there is a very early stage for cataract where you do not require any treatment. There is a mid stage where generally most people require treatment, and that is when the doctors advise you to go ahead with the treatment. And there is an advanced stage. Now we never want you to go to the advanced or mature stage of cataract, because when the cataract becomes mature, it swells up, it becomes fluffy, it may burst, and when it bursts, it increases the pressure of the eye and can damage your nerve, and this may be an irreversible damage. So now we say that it is the immature stage where you should get it treated and not wait for it to become a mature cataract. And what is the treatment for cataract? The only treatment for cataract is a surgical treatment. No medicines can cure a cataract, because it's a lens which has already become whitish. You cannot get it back to again being transparent with eye drops, and no spectacles can take care of your vision when you have a cataract. So the only treatment is surgery, and this is a very advanced surgical treatment which we call Phacoemulsification, in which we remove your cataract and we replace it with an artificial lens, and this artificial lens is forever. So the treatment for cataract is Phacoemulsification surgery. And what exactly is this Phacoemulsification surgery? Now many people, as soon as they hear the name surgery, they become scared. But there is nothing to be scared about, because this is a myth that Phacoemulsification surgery would be painful. They still believe that we would do it in the olden way, where we made a very large incision, we removed the whole cataract, and then we put multiple stitches, and those would be painful. So that is no longer the technique that is followed. The technique that is now followed is where we make a very small 1.8 mm incision. We take out the cataract by emulsifying it and making it into small pieces and sucking it out with what is called a phacoemulsifier, and after that we do not even need any stitches. So during the surgery, which lasts somewhere around 5 to 7 minutes, you are awake, you are conscious, though there are anesthetic drops in the eyes, so you do not feel any pain, and it's a walk-in walk-out surgery, which means you come in, you get operated, and as soon as you get operated you go back home, and it's totally painless even in the post-operative period. So in a cataract surgery, when we remove the lens, we replace it with an artificial lens, which is called an intraocular lens. And there are different types of intraocular lenses. There can be monofocal lenses which work for distance, there can be multifocal lenses which can work for distance and near, there can be trifocal lenses which work for distance, intermediate and near. So we basically understand what your requirements are and customize the lens as per your need. So this is all about cataract and how cataract is treated. Hope you liked this video. Do subscribe to our channel and keep returning to our channel for similar, more informative videos. Thank you.